Inflammation and Repair, Chapter 3. Overview of inflammation. Definitions and general features of inflammation. Definition: inflammation is a response of vascularized tissue to infections and damaged tissues that brings the cells and molecules of host cell from the circulation to the site where they are needed in order to eliminate the offending agents. So inflammation is a response of the vascularized tissue to any kind of infectious agent or the tissue which is damaged, and this response occurs by bringing the cells which are flowing in the normal circulation of the host defense into the site where they are needed to bring about the response. Although in common medical and lay parlance, inflammation suggests a harmful reaction, it is actually a protective response that is essential for the survival. It serves to get rid of the host of both initial cause of cell injury like microbes and toxics and consequences of such injury like necrotic cells and tissue. The mediator of defense include phagocytic leukocytes, antibodies, complement proteins. Most of these normally circulate in the body in blood, from which they can be rapidly recruited to any site in the body. Some of these cells also reside in the tissue. The process of inflammation delivers these cells and protein to damaged or necrotic tissues and foreign invaders such as microbes and activates the recruited cells and molecules, which then function to get rid of the harmful or unwanted substances. Without inflammation, infection would go unchecked, wounds would never heal, and injured tissues might remain permanent festering sores. In addition to inflammatory cell, complements of innate immunity include other cells such as natural killer cells, dendritic cells, epithelial cells, as well as soluble factors such as proteins of complement system. Together, this complement of innate immunity serve as a first response to infection. They also function to eliminate damaged cells and foreign bodies. So there is an innate immunity cells which act as a first line of defense to the foreign bodies. Typically, inflammatory reaction develops through a series of sequential steps. The offending agent, which is located in extravascular tissue, is recognized by host cell and molecules. Leukocytes and plasma cells are recruited from the circulation to the site where the offending agent is located. So there is offending agent which is extravascular tissue, which is recognized by host cells and molecules. Leukocytes and plasma proteins are recruited from the circulation to the site where the offending agent is loaded. The leukocytes and proteins are activated and work together to destroy and eliminate the offending substances. The reaction is controlled and terminated. The damaged tissue is repaired. Before discussing the mechanisms, the functions, and pathology of the inflammatory response, it is useful to review some of the fundamental properties. Complements of inflammatory response. The major participants of the inflammatory reaction in the tissues are blood vessels and leukocytes. So this is the figure where the microbes enters and causes the damage, or the damage is either caused by necrotic tissue. So the macrophage, dendritic cell and mast cells recognition by macrophage and other sentinel cells in the tissues. Mediators are amines and cytokines. Recruitment of the leukocytes, monocyte, granulocyte and plasma protein complement kinins and other. Vasodilation, increased vascular permeability leading to edema. Macrophage and granulocyte, elimination of microbes and dead tissue, and plasma proteins complement kinins and other mediator of inflammation, elimination of microbes. Cytokines, growth factor, fibroblasts, extracellular matrix, protein and cells repair. Sequence of events in the inflammatory reaction. Macrophage and other cells in the tissue recognize the microbe and damaged cells like necrotic tissues and infectious agents and liberate the mediators, which triggers the vascular and cellular reaction. As will be discussed in more detail later, blood vessels dilate to slow down the blood flow, and by increasing their permeability, they enable selected circulating proteins to enter the site of infection or tissue damage. Characteristics of the endothelial lining blood vessel also change, such as circulating leukocyte first come to the halt and then migrate into the tissues. Leukocytes, once recruited, are activated and require the ability to ingest and destroy the microbes and dead cells, as well as foreign bodies and other unwanted materials in the tissues. Harmful consequences of inflammation. Protective inflammatory reaction to infections are often accompanied by local tissue damage. So, the protective mechanism might damage the local tissues, and its associated signs and symptoms are pain, functional impairment. Typically, however, these harmful consequences are self-limited and resolve as the inflammation abates, leaving little or no permanent damage. So these are only for a while, and as the inflammation overs, they leave little or no permanent damage. In contrast, there are many diseases in which the inflammatory reaction is misdirected, that is, against the self tissues, to autoimmune diseases. So the misdirection of inflammatory reaction might lead to autoimmune diseases, which occurs against normally harmless environmental substances. Example in allergies and inadequately controlled. In these cases, normally protective inflammatory reaction becomes the cause of disease, and the damage it causes is the predominant feature. In clinical medicine, great attention is given to the injurious consequences of inflammation. Disease caused by inflammatory reactions. Acute respiratory distress syndrome by neutrophils, asthma by eosinophils and IgE antibodies, granulonephritis by antibodies and complement neutrophils and monocytes, septic shock caused by cytokines, and chronic arthritis by lymphocytes, macrophages, and antibodies, asthma by eosinophils and IgE antibodies, atherosclerosis by macrophages and lymphocytes, pulmonary fibrosis by macrophages and fibroblasts. Listed are selected examples of diseases in which inflammatory response plays a significant role in tissue injury. Some, such as asthma, can present with acute inflammation or chronic illness with repeated bouts of acute exacerbation. This disease and their pathogenesis are discussed in relevant chapters. Inflammatory reactions underlie common chronic diseases such as rheumatic arthritis, atherosclerosis, and lung fibrosis, as well as life-threatening hypersensitivity reactions to insect bites, drugs, toxins. For this reason, our pharmacies bound with anti-inflammatory drugs, which ideally would control the harmful sequel of inflammation, yet not interfere with its beneficial effect. In fact, inflammation may contribute to a variety of diseases that are thought to be primarily metabolic, degenerative, or genetic disorder. Inflammation can also contribute to primary metabolic, degenerative, or genetic disorders such as type 2 diabetes, Alzheimer's disease, and cancer. In recognition of a wide-ranging harmful consequences of inflammation, the lay press has rather melodramatically referred it as the silent killer. Local and systemic inflammation. So this inflammation is referred to as silent killer can be asked in a justification, as the inflammation might misguide the recovery towards the autoimmune diseases and can lead to some damage to the body. So they are called as silent killers. And inflammation is caused by sugars and spices. So generally it is prescribed nowadays by doctors and advised not to eat much of sugar and spices, as this is the silent killer. Local and systemic inflammation. Much of this discussion of inflammation focuses on tissue reaction, that it is a local response to an inflammation. Much of this discussion of inflammation focuses on tissue reaction that would be a local reaction to an infection or to the localized damage. Although even such local reactions can have some systemic manifestation, for example fever, in the setting of bacterial and viral pharyngitis, the reaction is largely confined to the site of infection or damage. In rare situations such as some disseminated bacterial infection, the inflammation reaction is systemic and causes widespread pathological abnormalities. This reaction has been called as sepsis. So, in a rare condition such as disseminated bacterial infection, which occurs throughout, the inflammatory reaction is systemic. So, as the infection has spread throughout the body, so the inflammation would also, and causes the widespread pathogenic abnormalities. This reaction has been called as sepsis, which is one form of systemic inflammatory response syndrome. Mediators of inflammation. The vascular and cellular reaction of inflammation are triggered by soluble factors that are produced by various cells or cell derived from plasma proteins and are generated or activated in response to the inflammatory stimulus. Microbes, necrotic cells, whatever the cause of the death. And even hypoxia can trigger the elaboration of inflammation mediators and thus elicit the inflammation. Such mediators initiate and amplify the inflammatory response and determine its pattern, severity, and clinical and pathological manifestation. Acute and chronic inflammation. The initial rapid response to the infection and tissue damage is called acute inflammation. It typically develops within hours or minutes and is of short duration, lasting for several hours or a few days. Its main characteristics are the exudation of the fluid and plasma protein and emigration of leukocytes, predominantly neutrophils, and are also called as polymorphonuclear leukocytes. When the acute inflammation achieves its desired goal of eliminating the offender, the reaction subsides. But if the response fails to clear the stimulus, the reaction can progress to a protracted phase that is called as chronic inflammation. Chronic inflammation is a longer duration and is associated with more tissue destruction, the presence of lymphocytes and macrophage, the proliferative tissue. Chronic inflammation is discussed later in this chapter. Acute inflammation is one of the reactions of the type of host defense known as innate immunity, and chronic inflammation is more prominent in the reactions of adaptive immunity. Termination of inflammation and initiation of tissue repair. Inflammation is terminated when the offending agent is eliminated. The reaction revolves because the mediators are broken down and dissipated, and leukocytes have short lifespan in the tissues. In addition, anti-inflammatory mechanisms are activated, serving to control the response and prevent it from causing excessive damage to the host. Once inflammation has achieved its goal of eliminating the offending agent, it also sets its motion to the progress of tissue repair. Repair consists of a series of events that heal damaged tissue. In this process, the injured tissue is replaced through regeneration of surviving cells and filling the residual defect with connective tissue scarring. Repair consists of a series of events that heal the damaged tissue. In this process, The injured tissue is replaced through regeneration of surviving cells and filling of residual defects with connective tissue. This chapter describes the causes of the stimuli for inflammation and then the sequence of events, mediators, and morphologic pattern of acute inflammation. This is followed by discussion of chronic inflammation and then the process of tissue repair. The study of inflammation has a rich history, and we first touch on the past work that paved the way for our current understanding of this fascinating process.